Hello everyone, welcome back to my channel. Today I want to walk you guys through a lumbar spine MRI, which is a very common exam that is going to be ordered through the ER as an inpatient or post-surgical or even outpatient. So it's very common exam that is just going to get ordered for back pain, which is very common problem nowadays, specifically in people that they are aging like 40 above. It also in teenagers that they might just have some back pain because of the some kids that they are very active and do a sport, so they're going to have like lumbar spine MRI due to back pain. So this that type of age group have different entities and different reasons, but this specific talk that I'm just going to go through today is going to be about like people that they are just older age, 40 above, and they are going to have like this disease, they are going to have degenerative stuff, and that's the cause of back pain. So this is a common lumbar spine protocol as you see here. So we have on top left, we have this T2, like sagittal T2 sequence. Here we have sagittal T1 sequence. On bottom left, we have a stir sequence, and then here is actual T2. And we usually do the actual T1 as well. I will show it to you later, but we'll get back to that one. So first of all, I just want you to give you some clues to know how we recognize what sequence is what. So first of all, we see that these fat and subcutaneous soft tissues that are containing fat is going to be bright, so like the brain. So this is an indication that this is a T2 sequence. The other clue is you see the CSF in the spinal canal that is all bright because it's water. So basically these two clues showing you that this is a T2 sequence and is sagittal. This sequence right here is a T1 sequence. We see that the marrow signal in the vertebral bodies are bright because we have normal fat when you're just getting older. So you're just going to have yellow marrow in your marrow structures, and it's going to be containing fat, and then it's going to be bright. And then you're going to see in the subcutaneous soft tissue some fat that is just going to be again bright. And then when you have like T1 sequence, basically the spinal canal and the CSF is going to be all dark like the brain. So from this point of view, from the spinal canal that is all dark, I know that it's a T1 sequence. This is a stir sequence that is very money sequence for the lumbar spine, because anything that is just pathology, metastasis, edema, anything that is just going to be bright on this sequence is pathology. So basically we are going to suppress the fat. You see that the subcutaneous fat is going to be all dark, and then we see some normal vessels that they are here, and then like the spinal canal is going to be bright, and then this is going to be cord. We see the distal cord and the conus, and then usually we are going to have a suppression of the T1 brightness that we saw on the fat, and then we're just going to see everything is dark. So basically, if now you have anything that's like fracture, if you have edema, if you have like some sort of matter replacing processes, is going to be showing up as light up in the vertebral bodies as like stir bright. Just remember that. So this is just a normal appearance of the stir sequence, like spinal canal and vertebral bodies and the soft tissues. It's just going to be all dark, except this spinal canal with CSF that is bright. Okay, this is actual sequence, the same concept. You see that this is the actual sequence through the lumbar spine, and then we see soft tissues, we see the bright fat, we see the CSF that is bright. Okay, so when we do this, then we are just going through our search pattern. So first of all, we look for the alignment. So basically, we are looking, if this is a trauma case, for instance, we are looking if we have any traumatic malalignment. So basically, you are going to looking for any vertebral bodies that they are just going forward or going backward in relation to the other one. In this specific patient, we see that these all vertebral bodies are well aligned. I don't see any malalignment, and if I see some, it might be here a minimal retrolisthesis. You see that in this L3 in relation to L4, the posterior aspect is a little bit like posteriorly positioned, but it's not that much, it's just very minimal. So first of all, you look for the alignment, then you look for the vertebral bodies. You make sure the vertebral body heights, as you see here, is all preserved, there is no fracture. And then after that, we look at the marrow signal. We're going to make sure that the marrow signal on T1 sequence is preserved, as I told you before, and also on the stir sequence, we are going to confirm that there is no abnormal marrow replacing lesions. If you get post-contrast sequence, that's another sequence that helps you to find metastasis or marrow infiltration. Then I'm going to go look at the spinal canal and just basically look at these CSF around the distal cord and conus. We make sure there is no abnormal signal on that, and there is no like basically any processes going in the spinal canal. So you see that these codaconal nerves are freely distributed, and there is no mass effect on them, as you see here. And then finally, basically, when you look at the actual, that's the best way you look at your soft tissues. As you see here, we're just going to come down, and you see this is the liver, you see a spleen, you see kidneys, so you see some of the abdominal structures that you want to make sure there is no abdominal aorta, aneurysm, and then you're just looking at adrenal glands. So just have an eyeball on the lower abdominal structures, make sure there is no gross pathology, because this is just going to be limited evaluation, but still you're going to see abdominal organs in this view. Then we are going to pay attention to the level by level, and then basically we're going to examine the patient for the reason of the back pain, and we are looking for any like disc disease. So this looks like a patient is generally has a very good back, like lumbar spine. I don't see like any fracture, I don't see any like severe malalignment, but when I look closely, like on these all these levels, the only level that has pathology is this level that is L5S1, and you see that there is some sort of disc protrusion happening at this level. So if in order to just characterize, we just go back to your axial, and then when you go down, you see that this is just very normal appearance. We don't see any that much disc bulge at these levels, like these are the facets, and you see the spinal canal is very well filled with the CSF, and the codochronal nerves are freely distributed. So this is a normal appearance. You are going to always look for this. But when we go to that level, that is the level that causes pain, L5S1, right here, you see that there is a bilobe appearing structure here. So this is a disc protrusion, as you see here, and then there is some extruded fragment down there. So basically, when we want to discuss this, or we want to just dictate, you're just going to say there is a central disc protrusion with some sort of left paracentral extruded fragment that is just projecting here into the thecal sac. As you see, it's just like touching the ligamentum flavum and facet joint, and here, right there, as you see here, this is the S1 a nerve root that is just getting compressed by this extrusion here. So this protrusion with extruded fragment causing mass effect on the left S1 right there, and also somewhat it's just touching the right S1 here. So how do we decide which nerve root we are talking about? So basically, this is another important concept, which is actually a board question. When you're talking about L5S1, the nerve roots that are just exiting from the foramen is just going to be L5. So basically they get the number from the vertebral body above them. So these nerve roots that we see here, that they are just exiting from the neuroforamen at that level, this one and this one, they are L5. And then these ones that they are descending down through the spinal canal, these are going to be S1. So basically, the reason that this patient has pain is because of like this protrusion and extrusion that causing just compression, specifically on the left S1, and then lesser degree on the right S1. Okay, so if you like this video, please don't forget to subscribe and just follow me on this journey. Thank you.